we're going to start learning about resiliency in healthcare almost right away. And it's my privilege to introduce this panel and hand it over quickly to our moderator, Nicolette Lassant. She's the Senior VP for Policy and Strategic Planning for the Healthcare Distribution Alliance. And gosh, after this year especially, resiliency in healthcare is an all-consuming topic. We have a lot of experts assembled for you, and I hope you'll ask them questions. You can do that in the chat. Nicolette, thank you for being our moderator today. I'm going to hand it over to you.
Hi, so I am not Nicolette, sorry, but unfortunately Nicolette was unable to join us today. So I'll be stepping in to hopefully do my best to fill her very, very large expert shoes. But I'm Courtney Romold. I'm Programs Manager at Healthcare Ready. And I'm looking forward to introducing these panelists as well as really leading a discussion on healthcare resilience across the many parts of the supply chain where they lead. And so I'll quickly introduce our panelists and we'll jump right in. So first I'll introduce Chad Mitchell. Chad is the Associate Vice President for Sourcing Operations and MedSurg Distribution at Vizient. Chad joined Vizient in December 2018 as Senior Director for Sourcing Operations and MedSurg Distribution. In this capacity, he had oversight for contracting initiatives and standards, plus strategic supplier partnerships. As the pandemic surged throughout much of 2020, Chad was the primary lead of Vizient's COVID-19 response war room, a cross-functional team of subject matter experts, sourcing staff, and clinicians. In July of 2021, Chad was promoted to Associate Vice President for Sourcing Operations, where he maintains his previous duties in combination with additional portfolio oversight and execution across supplemental, medical, surgical, and lab portfolios. Next, we have Chuck Forsyth with the Healthcare Distribution Alliance. Chuck is Vice President of HDA's Pharmaceutical Cargo Security Coalition, or PCSC. Chuck has been involved in pharmaceutical supply chain security for more than 16 years, following a career as both a New Hampshire municipal and state police officer. He also directed security operations for United States military intelligence gathering installation. The PCSC, which Chuck formed back in 2006, brings together professionals from a wide variety of disciplines to monitor the security of pharmaceutical goods in transit and storage all over the world. And next we have Scott Cormier with MedExcel, where he serves as Vice President of Emergency Management, Environment of Care and Safety. Scott has more than 30 years of experience in emergency preparedness, health and safety, and counterintelligence operations. Prior to joining MedExcel, Scott served as a Senior Director of Emergency Preparedness and Management for the Hospital Corporation of America, or HCA, which is the largest private healthcare provider in the world. And last but not least, Sean Brzezowski serves as Program Analyst at Healthcare Ready. Since joining Healthcare Ready back in March of 2020, Sean has continuously supported and led in coordination efforts for healthcare COVID-19 private sector task force, and previously Healthcare Ready's private sector coalition. He's supported on public and private stakeholder management and supply chain policy analysis. So I want to thank all of you for joining this panel. We truly have a range of deep expertise and experience. So grateful to have you in this discussion today. I want to kick us off by asking everyone, and this is a question for everyone, to share a bit about how your organization fits into the healthcare supply chain and how you think about resilience from your perspective along the chain. And kind of going to go up the chain in a way. So we'll start with Scott, then go to Chad, then Chuck, then Sean.
Hey, thank you very much, and good afternoon, everybody. You know, a great question. So at the foundation of who we are in healthcare, we say that during our community's greatest time of need, during a disaster, whether it's a pandemic or a hurricane or a tornado or a snowstorm, we need to be there to serve the community. And the way we've been able to do that is by really changing the dialogue about what healthcare resiliency is. So many healthcare leaders think that it's a revenue depleting department that only serves a purpose of making sure we meet regulatory requirements. And what we showed is that we're actually a revenue generating department. As a matter of fact, we had a national auditor come in and they're looking at our operations. And if you're in healthcare, every couple of years, the auditors come in to see where you can cut costs. And after our hour-long session, the lead auditor said, I can see that for every dollar you spend on resiliency, you're getting $5 in return. And so because of that, we had a pandemic stockpile. We have standardized emergency operations procedures. And so when the pandemic occurred, we were well prepared to deal with that. Thank you.
Am I up next, Courtney? Okay, appreciate the invite again, and thank you for the nice introduction as well, Courtney. So just to reiterate, Resilient's the country's largest member-owned performance improvement company. We've got more than 5,000 members that we service across the country. And we find ourselves at Vizient in a very unique position between the member, or what you would think of as a provider, as well as manufacturers and distributors. Oftentimes, all three of those entities look to Vizient to gather information and to provide support to ultimately lead one of those three groups to their goal. Through supply assurance as well as resiliency, we find ourselves really in the smack dab middle of that. We are responsible to bring the right price, the right product at the right time to the customer. And so we are really entrenched and ingrained in all things supply assurance and resiliency right now.
I'm up, Courtney.
Yes, please.
Okay. As was said in the introduction, I work for the Healthcare Distribution Alliance, and I run a particular coalition within that alliance called the Pharmaceutical Cargo Security Coalition. There's about 1,500 members in that. Most of them work within security disciplines, things like brand protection, anti-counterfeiting, things like that. But there are a number of supply chain supporting vendors in the coalition as well. And that involves transportation, insurance, law enforcement, all kinds of similar industries that support the movement of goods in and around, pretty much in and around the world. Our principal focus is that we're trying to assure that the products get from the point of origin in the supply chain to the patient in the condition they were originally intended, that no one attempts to remove them or disrupt them in the supply chain, or try to introduce anything that's related to counterfeiting product or diversion or anything like that. Scott and I just became best friends here with the comment that he made before, where he goes, I see security as a revenue draining discipline as opposed to a revenue generating one. I have similar statistics that he has that indicate that what we do actually is a revenue generating part of the whole supply chain. If you can't maintain the integrity of that chain and you have to replace things that you've lost, the costs of that are astronomical. And that's pretty much why we do what we do. And it's been, most recently, as we'll talk later on in this discussion, in the last 2 years, particularly with vaccines, it's shown its way.
Absolutely. Sean, over to you.
Yeah, and I'll round it off. Hey everyone, Sean Brzezowski, program analyst here at Healthcare Ready. Appreciate you giving me that introduction, Courtney, and it's a pleasure to be joined here with Chad, Chuck, and Scott. To give a bit of background on Healthcare Ready, it's a 501c3 nonprofit organization that works to ensure patient access to healthcare in times of disasters and other hazardous events like disease outbreaks. We really do that by leveraging the strong relationships, with government, nonprofit, and then healthcare supply chains to really build and enhance the resiliency of communities, before, during, and then after those events. So we kind of serve as this linkage point for industry partners and government partners at all levels, federal, state, and local. And I think from my perspective, I love all the points that Chad, Chuck, and Scott hit on, especially the point about, serving the community. I see that as resiliency. And then also from my personal perspective with my work here at Healthcare Ready, I've really seen it in two specific buckets, kind of communication. I've sat in on a lot of calls and, put together a lot of calls with a bunch of different partners from the public and private sector. And, communication is so key, ensuring the right people are at the table to have those conversations, right? Not all of them need high-level leadership. Some just need subject matter experts from both sides. But then also the second bucket, information sharing. We're in a day and age where there's so many different avenues that you can get information from. So it's really important to get the right information to the right people. I feel like there's a bunch of different things, as all three of the other panelists had touched on, but those are definitely two strong areas where I see resiliency coming in.
Absolutely. And thank you all for those answers. I think that sets us up for a really great discussion. And also appreciate the points on kind of the return on investment for security and for resilience. I think there's sometimes kind of a narrative that we don't see those investments pay off until much longer term. But I think your statistics and what you've seen shows that there are also very quick short-term benefits. So appreciate that insight. I'm going to take us back a few years now, since so much has happened and a lot has changed in a short amount of time. Want to hear a bit about what your response plans and actions look like as of March 2020. So when COVID was reaching community transmission levels in the US. And I'll go ahead and start with Scott again.
Yeah, thank you. So as I said, we have a pretty good program. We had a pandemic program. We had a pandemic stockpile. We knew burn rates at flu season were 120% of normal burn rates in PPE. And I think what really helped us through it is on January 20th of 2020, we received the second COVID patient in the United States. And then 5 days later, we received the fifth patient in the US. And so as we're there in our hospital and we're with the CDC and the state and local health departments, and everybody's learning about COVID, we're learning about what it's going to take to respond to it. We saw the burn rates were high. We saw that furlough was going to be an issue. We saw that there were issues with negative pressure and confusion about what type of room and setting. We saw that, the debate about, do we need negative pressure ORs versus negative pressure any rooms for ORs? And so in January, as we're learning all this, and then 6 weeks later, we discharged the patients. And also we learned that you can't just send them home, right? Because now the community is scared of them and what's been going on in their house for the last 6 weeks. We increasing our stockpile. And we shared a lot of that information with our partners at the federal government. Hey, here's what we're seeing. This was what we need to be prepared for. And because of that, when March hit, we never had to use unapproved PPE like snorkel masks or bandanas or things like that. We've never had to wear PPE for longer than a day. We never had to use reprocessed PPE just because we had the plan first. And then we were able to build on it from that the very early cases we had.
Thanks for that, Scott. I'll turn the same question to Chad. What did things look like for you and your organization in March 2020?
First of all, it's surreal to think that it's been 2 years, isn't it? So much like Scott, and Vizient had dealt with emergencies and disasters before. And so quickly back in January or February of 2020, we stood up a 10 to 15 person war room within our sourcing department. And we felt as though medical surgical supplies were bound to be the supplies, as is normally the case, that were impacted and affected here. What we realized very, very quickly was that this was so much different. This had tentacles that spread across lab. It spread across pharmacy. We started to get inquiries from our members and our field teammates by the hundreds, not by the tens or teens, specific to any one region or area. So what we realized right away was 10 to 15 people was not sufficient. That quickly, within a couple of weeks, became a 75-person war room where we were taking hundreds of inquiries every single day in support of our customers and our field staff. But what we also realized quickly is that we had to set up subgroups And we developed probably 14 different subgroups, some of which responded to the intake of inquiries, reaching out to our supplier partners to try and find alternative products. Another subcommittee focused on vetting suppliers. This was a whole new arena as well. You know, historically, as a contracting agent to our members, we're getting into a contract for a period of time and the customer knows what they're going to use. Well, now those suppliers don't have products, so they're going overseas, they're talking to brokers, and so we're talking to brand new organizations. We vetted over 10,000 different organizations. Only 25% of that 10,000 passed our vetting. You know, there were 10 people alone that helped support that subgroup as well. So a lot of different people certainly stepping up and stepping out, leaning in to support the broader efforts.
Absolutely. And I think that kind of theme of stepping up and stepping out and taking on a lot more and adapting new things goes for just about everyone across the healthcare sector. So appreciate that insight. And I'll turn it to Chuck next.
Back in that time frame, we saw what was happening, and we knew that vaccines were in the process of being developed, and we knew that those vaccines would become so critical, they would literally be treated like gold. And we also knew that there were going to be heavy security requirements around the facilities that were going to manufacture those goods and things like that. So to be quite honest, before we put our team together, we were actually contacted, both BARDA and the United States Marshals, who would ultimately be the escorts for some of the initial vaccine shipments, reached out to us for our expertise in supply chain security, moving high risk, high value goods and stuff like that. But we also knew from other types, moving those other types of products in similar veins, that perpetrators or bad guys, whatever you want to call them, would plan, they would somewhat announce what they were doing, but on social platforms, dark web, places where you wouldn't normally see that particular type of activity. So we elicited 2 private industry companies, Hetherington Group in New Jersey and Microsoft. And we went to them and we said, look, we know that these conversations go on behind the scenes. Would you be willing, if we gave you all of the technical terms, the terms of, you know, the names of the vaccines, the lanes they were traveling in, who's going to move them, if you would take that information and feed it into the search engines and come back to us with intelligence about these types of moves? We knew the bad guys wouldn't talk about it openly, but they would leave breadcrumbs. They would leave information that would tell us about anti-vax demonstrations, about attempts that, you know, for burglaries of warehouses and things like that. And we went out and we elicited members from industry. We got all the manufacturers to participate. We got all of the distributors, Amerisource, Cardinal, McKesson. And then we went into the vendor space. We got all of the transportation entities, the trucking companies, the airlines that would fly. And we combined all of these folks, like Scott and Chad have said, I mean, to coordinate as best as we could all of that type of information. You'd be amazed at how often in these types of situations where there isn't a lot of that coordination. We weren't the only ones that did it. I mean, Operation Warp Speed worked on it as well. This was one of the few times I've seen of a common cause where everybody, you know, pitched in. Any bad feelings that people had about different stuff, that all went away. It might be back again now, but it was all gone then at the time. And it really worked out quite well. It really did. And I'll explain later as you get down through the rest of the questions, how well that worked and how it did.
No, absolutely. And I want to come back to vaccine rollout and kind of all of the pivoting that had to happen across the board. But first, last panelist on this question, Sean, if you want to talk a bit about what things look like over with us at Healthcare Ready in March 2020.
Yeah, and I'll kind of intro this with, I think I provide a little bit different perspective than my other 3 panelists here, because, you know, from January through March 2020, I had no healthcare background. You know, prior to that, I had no healthcare background, and I actually, you know, signed on with Healthcare Ready in March of 2020. So the perspective I had actually going into this was, I heard about, COVID starting to rise, but I didn't have my, nose to the grindstone, or, it was just something that was going around. And then when I actually joined Healthcare Ready and saw, everyone ramping up, all these coordination calls happening, it was such a big surprise to me to see, how much work was actually going on, that, I wasn't even aware of. And, we had, we were in on calls with, distributors and federal partners, of course, Project Airbridge that was going on in the prioritization cells. And something that Chuck actually just said, that I couldn't agree more with was, during that time when we were really ramping up in March 2020 and even on from there, everyone was on board. And that was such a major help in, maintaining that resiliency in the supply chain, I think, because everyone was just on board, everyone was working together, on both sides, the public and private sector, and both ramping up at the same time at the same pace was just so critical. But yeah.
Absolutely. And speaking of ramping up, I'm going to flash forward a little bit. So now it's December 2020. Vaccines are rolling out. Also, again, hard to believe that that's over a year ago. But so kind of in general at that time point, but also as time went on across the response, how did you have to pivot? So how did you adapt or flex your plans to the changing situation? And I think vaccines is probably a really good example of that. And I'll start with Chuck actually on that, because he just mentioned vaccines.
It was a, for lack of a better term, moving target. Because what ends up happening is we saw problems, and a couple of problems that we didn't necessarily anticipate. I give you one. I mean, one of the things that people hadn't really thought about an awful lot was empty vaccine vials. How are they taken care of? How, we got to make sure that they're destroyed so that nobody else grabs them, tries to use them again. And I can remember having some distinct conversations with the folks over at Warp Speed at the time, the military guys, and saying that this is going to be an issue. This is going to be a real problem. We need to pivot somewhat here and put some focus on that. And they came right out with a number of different initiatives that we shared, not only within the government, but within industry as well. That worked out extremely well. The marshals, when they were moving shipments around and things like that, they weren't aware of the fact that we had intelligence. We used intelligence in shipment movements that not only relate to the tracking of the shipment, but are you going through areas where the weather is bad? Are you going through areas and communities where there's civil unrest, that could potentially affect how that shipment moves? So we threw that into the mix and said, you should be considering these types of things. And that helped to adjust, the way that we were handling those types of movements. And then as more vaccines were manufactured and more shipments were running, we had to again shift assets and allocations to be able to cover those. So it was like I said, it was a moving target. I mean, we were all part of those calls. I mean, every couple of weeks we would say out on the call, okay, this happened. We didn't necessarily expect it. We were able to deal with it. Let's share this with everybody else. That's how that went pretty much.
Sure. And I'll just open it up to anyone else that wants to jump in on kind of vaccines or how you flexed or pivoted plans at different points.
Yeah, I'll chime in just real quick. So, communication seems to be a recurring theme here, but as we iterated, certainly here at Vizient, communication internally became as important as external communication. And so we certainly started communicating more with our data and analytics and insights teams to put together things like PPE burn rate calculators. We also put together a website as a landing page for our customers. So if they wanted to go out to see which region was going to be impacted next, they could at least position themselves or prepare accordingly. So just some of that communication internally helped aid and allowed us to create some of those tools. In addition, we got a request from customers saying, hey, I've got excess product and I want to share it with someone else. So we quickly stood up listservs. to be able to assist with things like that. Newsletters, things that historically maybe we had done monthly or quarterly, we had to push those sorts of communication out more regularly. So those turned into weekly sorts of communication.
Yeah, and this is Scott. We had a pivot on two things on the emergency management side, and then one thing on the vaccine side. So on the emergency management side, we serve a large healthcare system, over 150 hospitals and 2,000 sites of care across 20 states in the District of Columbia. And so when we started this process, what we do is we tell our sites of care, just care for your patients. Okay, we're going to centralize nationally treatment guidelines, PPE, infection prevention, supply chain, ventilators. We're going to do all that work. So you don't have to debate about, what treatment regime you need to use. And that worked very, very well for us. Now, in emergency management, you all know, we start thinking about the end of the disaster and the first day it starts. And I was mentally prepared for about a year of COVID. And so as we went past that, we really had to pivot and say, okay, so how do we incorporate a part of our emergency operations into everyday work? And that was kind of a big pivot for us. The second thing is, as COVID flowed, right? So as we had peaks and then valleys, our local hospitals during the valleys started to act a bit independently. And so as another peak came again, we found that they weren't following the standard guidance we had put out. And we had to corral them in and remind them, hold on a second, we're one health system and we're working together. And so don't start sort of going off the path. On the vaccine side, we put a group together in October of 2020 to start talking about how we're going to roll out vaccine with very little information, but we knew security and refrigeration and freezing and implementation, all those things were a part of the process. And so at the end of November, we had a pretty good playbook. What we didn't discover was that while the federal government was controlling vaccines, it was actually the states. And so in one state we worked in, they said, hospitals aren't getting vaccine. They all go to the public health department. All your healthcare workers have to come here. And another part of the state, or in another state, they said, hey, hospitals can get vaccine, but you have to be able to vaccinate everybody. And the tracking system you have to use is a state tracking system. And also, we're not going to share the names in the state tracking system, so you're not going to know who in your facility is vaccinated. In other states, they came to us and said, hey, can you help us set up some community vaccination clinics? And we did. And so we had this really good playbook that didn't account for all the variations we saw in different states. And then we had to adapt very quickly. And sometimes the adaptation was sitting down with the state leaders and saying, listen, this isn't working. We have a lot of experience and we'd like to show you maybe some other ways to do it. But it was a pivot for us.
Yeah, and kind of bouncing off actually what Scott and Chad had brought up, and I don't mean to sound like a broken record here, but Scott's point he had made, I couldn't agree more with, right? When we were thinking at the start of the pandemic, right, when is this going to end? I think we then slowly started to realize, like, this isn't going anywhere, like, anytime soon. So we kind of had to pivot those plans and really, like, adjust. I think, when we first started out with COVID, our main focus was focusing on the pandemic, but then, we're going into hurricane season now, flu season, and we really have to worry about those cascading impacts and hazards. So when we think about pivoting, we really need to think about, adapting our plans and being flexible with all these, coinciding impacts. But then also a point that Chad had brought up, I couldn't agree more with, was communication internally, but also externally. I know from our side, we were managing a lot of calls, sitting in on a lot of calls. And, at the start of the pandemic, it was great. Everyone was working together, ramping up, but it's hard to maintain that, right? And it's hard to maintain that level of partnership, especially at that high rate. And one thing we learned quickly was to maintain it, we don't want to burn anyone out. So, we, just as important as it is ramping up, it's important to start ramping down calls. A lot of the same organizations are on the same calls. So making sure information is getting to the right people, but, we don't want to say the same information 3 times in a row during a week. we learned that personally. We had our healthcare ready COVID task force calls. We had it, we had it twice a week, then moved to weekly and then monthly. And then finally we realized, like, I think we can stand this down because there are other avenues where, our members are getting this information from. We currently do still have weekly updates that I manage and send out to our partners, but we really did, we recognize the importance of ramping up, but also ramping down those coordination calls and, making sure our partnership doesn't get burned out.
Mhm. Yeah, and I want to pull on this thread, well, a couple of these threads, because there's also a question in chat from Persia saying you guys have been in overdrive way beyond past preparedness and crisis emergency plans. So how are you managing workforce fatigue, and any significant nuances from what you've learned to be included in plans and involving workforce going forward? And I'll open that up to anyone who'd like to respond.
Hey, this is Scott. A great question. When I look at our clinicians giving that care, and the type of care they're giving is not usual, right? It's holding somebody's hand because their family can't be with them as they're dying. It's explaining to a child what happened to their mother, or to a child about their parent. It's all these things. And so in our clinical areas, we created respite lounges. And the respite lounges is a quiet area. They have those really cool $3,000 massaging, reclining chairs, white noise. And just sometimes you just need to sit down for 5 minutes and just collect your thoughts. We created a huge national peer group where nurses could talk to nurses and doctors can talk to doctors. And sometimes that also helps. And then we created a lot of mental health services for our folks, whether in person or through telehealth services, to get that done. Now, for my safety and emergency management team, it was really rough for them because there's a lot of people who were working remotely. I wrote an email that says you will be front and center, right? We lead from the front, we don't lead from the rear. And so what I did is I made sure that our regional directors were ensuring that they used every bit of PTO, no matter if I had a cover or they had a cover, so that even though it's still on your mind, right? Our phones never shut off. Being with your family or being just away can help that process. And it's still a challenge too.
We had, for lack of it, intel fatigue. I could put together a briefing each and every day of articles and things that we found. Sean's laughing because he does the same thing that I do. After a while, he would filter back to me that, it's nice that you're putting out stuff like that, but we don't have time to read all of that each and every day. And so we strategically started to pare that down to the point where, as Sean indicated with Healthcare Ready, I mean, we had a couple of calls a week, then it went to weekly, then it went to monthly. The operation we ran, we called Operation VAX, and Operation VAX still exists today. There are still, Microsoft and Heatherington are still doing research for us, but we don't publish nearly as much as we did at the height. And we very critically look at what we will publish to make sure that it is something that people would be interested in digesting, not just putting stuff out for the sake of putting stuff out. I can remember too, in talking to the fellow that was leading the marshals' effort to escort all the shipments. There are only a certain number of marshals, and it got to the point where those guys got very fatigued, and they were told to stand down. They went from a stand down position to a jack up right after that, because that's when we started shipping vaccines out of the United States. And they had to go on those flights to be able to make the deliveries of the vaccines. But everybody went through that process. And I'm proud of the fact that, at least within my discipline anyway, we took note of what it was doing to people. And we tried to make adjustments so that it really wasn't gonna ruin the quality of the response that they were giving.
Yeah, the disciplined approach that Chuck just mentioned in terms of what we're putting out and how frequently we're putting it out now, it definitely resonates over here at Vizient. We're taking a much more disciplined approach to the what and the how frequent. In addition to that, as a member-owned organization, we continue to rally around the cause, right? Rally around the cause that we are supporting our membership and those frontline workers. But I would say the one other thing that really stands out is we're taking the next person up mentality. Just as Scott said, you got to take your vacation. We also recognize that as we continue to stand up different subgroups in support of supply assurance, we can't continue to tap the same person over and over again because most of them have full-time jobs that they're expected to continue doing.
Yeah, and kind of going off that, I can't stress that enough. I know my time here at Healthcare Ready, my managers, my leadership has always stressed to, every one of us, take your time off, take your breaks. It's just as important. One thing personally I always think about is, like if I take time off, who's going to do this? Who's going to do that? But like, that's when you have to trust your coworkers. You have to trust the system, because it doesn't help if you're still in that position and being burnt out. It'll only be a detriment. So I can't stress enough, taking breaks. It's helped me a bunch, and I'm sure it's helped everyone.
Yeah, and kind of wrapping up based on what Sean just said, and also Scott, I might have to petition for the reclining chairs for the Healthcare Ready office. But we are still remote, so we'll one for each person. But kind of going back to what Sean said as far as redundancy even within the organization so that people can take time off, I think is an important piece. And building in SOPs, which is something we do a lot, standard operating procedures for tasks that we know have to be done no matter what. So if Sean is running this call and he's organizing things and he's out, well, we've got the SOP, someone else can pick it up. So it allows people to take breaks and spread the load. So I'll say that's something we've had those procedures before COVID, but they've become even more important. And so kind of shifting gears a little bit, but pulling on some threads raised before, kind of ramping down out of COVID, or hopefully, but the idea of kind of a continuity plan or a response plan is to eventually get back to some sense of normalcy. So with a prolonged event like COVID, how do we get out of emergency management mode? What does that look like? And I'll open it up to anyone who'd like to answer first.
Hey, I'll start. It's to me, it's incorporated formerly uncommon tasks into everyday work. Like we knew before COVID that 60% of healthcare workers that don an N95 respirator don it improperly. And so it wasn't a big deal because we didn't use it a lot. We had a couple of airborne isolation rooms. We had some people on airborne precautions. But how do you take those things and work them into their everyday operations? And so all those aspects, whether it's supply chain, keeping a closer track on supplies and ventilators, whether it's our people ensuring that they're communicating if they have any symptoms, because a lot of those things were really good things anyways. I mean, we probably should have done them before COVID. And so once we do that, and that becomes muscle memory, right, then we don't have to sit there and remind everybody. And there's a lot of things that we're incorporating into everyday tasks. So we're seeing the future. I'm holding out for 2023, but let's take all these improvements we've had in healthcare and PPE and infection prevention and maintain them after COVID's gone.
Yeah, I like that. The details matter. The details matter now more than ever. We continue to hear in healthcare across different supply chain personnel that the second, the third page of the newspaper matters now. Prior to COVID, we had 70%, nearly 70% of our membership engaged in some sort of just-in-time or low unit measure inventory. Through the brunt of COVID back in 2020 and into 2021, we heard themes. The only supply chain I trust right now is one I own. And so we're in this dynamic right now where we've got to think about what are organizationally, as well as an industry, what are we doing to support the next pandemic? Are we leaning on or leveraging third-party logistical companies within healthcare the way we could to manage customer-owned inventory or manufacturer-owned inventory? How do we bring things stateside or nearshore? Widget may still be manufactured overseas, but can we maintain 6 months worth of stockpile somewhere? Who owns that stockpile? I think those are conversations, creative conversations that need to continue to exist even once we get back to some level of normalcy. But I think that the one other thing that we continue to say, and it's been brought up as a theme here, is this is the new normal. And we need to be comfortable with that.
I'd echo what Chad said in that the people that do what I do, most of us are retired military or retired law enforcement. So we've only been doing this. For me, it's been about 15 years. But in that 15-year time frame, we've never experienced anything like this. And as he indicates, this is going to be the new normal. And there's the distinct possibility that something like this could happen again. So rather than take all those papers and everything we've done and say, okay, we're finished, we're done, and get rid of that, we're saving all that stuff. And we're using, the lessons learned from what happened. And we're going to be ready next time, more ready than we were this time. I mean, depends on what it's like. I mean, it depends on what we're going to be facing. But I think the level of communication, the theme that is run through this entire presentation, is going to be a lot better, and we can ramp it up a lot quicker than we did the first time. And I'm not knocking the way we did it the first time because no one's experienced that in our lifetimes. But we're now better prepared to handle that again, I think.
Yeah, Chuck, you made this great point. I remember in the early days of COVID, again, since we had that early experience, we were talking to congressional leaders and government leaders. And I think I started every sentence off with, well, remember back in 2009 during the H1N1 pandemic? Do you remember what we did there? Do you remember the lessons learned? And it's like we went through it and then we went, okay, put the papers in the desk drawer. There has to be this continuous learning and improvement process. We do it in healthcare with our patients, right? We need to do this with our resiliency as well.
Yeah, and I don't have too much to add to what Chad, Chuck, and Scott had just mentioned, but when I was thinking about your question, all I could think of was, it's sort of a question I've had personally with like family and friends, like, that question of when do we go back to normal? But, as it's been discussed here, it's not when, it's more, what does that new normal look like? As everyone's kind of talked about it, they've said their points, but another point I'd like to add is, that new normal, I think we saw like a lot of like, emergency like policies and regulations being put in place, that kind of helped with populations getting access to healthcare, whether it was, we had pharmacies having the pharmacists, but also, their technicians being able to, provide vaccines and whatnot. Those are definitely things to think about as we're moving forward. Like, hey, they might not need to be put in place, constantly, but we should be able to bring back up those emergency like regulations and policies quicker. That way in the future, if we need to ramp up again, we can easily do that.
I think this is drawing a bit on kind of what we've just spoken about. COVID's not the only thing we're going to be facing. It's unfortunately not. And it's not the only thing we have faced in the last 2 years. I know Healthcare Ready in 2021 activated for 27 distinct natural hazards and other events. So there are other things out there. So want to talk a bit more about kind of what the impacts of climate change, increasing natural disaster, and how we're seeing the pandemic shift. How do we continue to ensure that resiliency is maintained across the supply chain and not just for COVID, but all these other hazards that we'll be facing?
Yeah, maybe I'll start. one thing that resonates with me is supply chain transparency. We've talked again about transparency. We've talked about communication as themes throughout this conversation, but having a singular source of truth of where raw materials are sourced from and where finished goods are produced, so that we as an industry, especially as we continue to see things happen like SKU rationalization, right? Organizations, suppliers continue to look at what they're manufacturing and ask themselves, can I produce more efficiently and effectively by maybe ratcheting down the number of SKUs or products that I'm producing? If that's the case, there may be fewer alternatives should there be a supply chain bottleneck. So it's vitally important that we have insights in order to draw more predictability and secondary alternative sourcing strategies.
Yeah, I would agree with that. I mean, we in the security piece, I mean, we encourage the manufacturers and distributors to quote unquote map their supply chain so they know where things are coming from. I mean, prior to the pandemic, I don't necessarily think that was done as much as it could have been or should have been. There's an old guy that lives right next door to me. He's like 85 years old. And in the summertime, when we're mowing our lawns on Saturdays, we both meet at the fence because we're mowing the last row about the same time. He comes over to me this past summer and end of August, and he looks at me dead serious in the eye. He goes, "You're in supply chain, right?" I go, "Yeah." He goes, "So what's that like?" And trying to explain that to him in the vein that we're talking about now. But to go back, Courtney, to your question, the security piece doesn't necessarily get involved in the climate change aspect and things. But as far as natural disasters and stuff, if Nicolette was on the call, she would tell you that I can't count how many times she's come to me and said, "Look, we need a special mode of transportation. We need a vehicle that can go through lakes, to get to hospitals that are isolated by this or that. Or we need a bus to take people from a hospital that get insulin every day and they're not, that the hospital doesn't have electricity anymore, I can't maintain it." So the different associations, Healthcare Ready, the Pharmaceutical Security Institute, RX360, and PCSC, we've rallied now to the point where it's just a pickup of the phone. What do you need? Do you need a plane? Do you need a bus? Do you need special types of equipment? I might not be able to get it for you directly, but I know who can, and I can get you that information. And picture balancing that. I'm not telling Scott or Chad anything different, but balancing that while still moving vaccines around at the same time. It's a juggling act, but I'm here to tell you, we've gotten better at it. That's one thing that COVID's done. It's gotten us better at those things.
Yeah, and one thing I kind of want to add to that was, that idea of, making sure when we're thinking about resiliency, making sure plans are flexible and we're constantly, adapting, making those incremental improvements. I think one thing we saw, especially related to climate change, back when we saw those winter storms in Texas, we saw, resin manufacturing go down for a little bit. Like who would have thought that, we'd have such severe winter storms in Texas. I think at that point, like the pipes and some of the infrastructure, like they weren't built to withstand that type of weather. So it's kind of, taking these lessons learned, taking these events, making those incremental improvements as we move forward. I'm also thinking about, I think in Oregon, when we saw those severe heat waves, actually, and a lot of apartments in Oregon, they don't even have AC installed into those apartments because they don't get into, above 100-degree weather. So again, there's so many different aspects we've seen from 2020 on until now. But like Chuck said, the supply chain never broke. I think what this pandemic has done is it's shed light on some areas where we can definitely improve, and I think we're moving forward with that.
Yeah, I fully support looking at our capabilities within the U.S. We've known for decades about pharmaceutical and raw materials and other medical supplies are outside of this country. And when we first started with COVID, we saw India, which has a lot of pharmaceutical raw materials, restrict exports, which affected us. And we saw China restrict exports, which hurt us. And so I think at a federal level, we really need to look at what our capabilities are for resiliency. The second thing we need to do is, as you said, we need to pivot. So we worked with the federal government on authoring a paper on healthcare resiliency and climate change. And our health systems have made a huge commitment to sustainability. So as we move to a more sustainable healthcare culture, for instance, electric vehicles, what does that look like when you lose power like you did in Texas during the winter ice storm? How do you get those things recharged? Or if you're using microgrids, how does that work in today's system when a disaster strikes? And so we always have to be progressively forward thinking about what does the next phase of emergency management look like as healthcare and energy and climate changes.
Absolutely, and thanks all for those answers. I've got a lot of notes that I might be asking Scott for that report to review later. In our last 10 minutes or so here, I kind of just want to ask for last thoughts from each of you, kind of just a quick hit of your last thing that you want to leave the audience with as far as healthcare supply chain resilience moving forward, what that needs to look like. And then, of course, happy to open it up for audience questions following that. But kind of quick recap, last thoughts. And I'll start with Chad. I see you're off mute. Sorry.
No problem. So, three themes, I think, to me, beyond the communication and transparency to leave the audience with. Number one is there's an opportunity for us to, as an industry, continue to build and share awareness to stay ahead of the next problem or the next bottleneck. Additionally, to look at expansion of capacity. And so what does that mean? Does that mean stateside manufacturing? Does that mean, as we talked about earlier, nearshore storage? And how can we work together, again, in support of the industry to stand up potentially more manufacturing stateside, and then furthermore, be willing to pay a price point that may look different than the price point when products are manufactured overseas. Third, and Scott kind of touched on this, is further advocating of resources for federal and state support to assist with things like inflation, transparency to where products are sourced from, things such as that.
I would say that Sean brought up a good point. It bent, but it didn't break. I mean, as far as the supply chain went and stuff like that. We in the security discipline took a lot of lessons, and I'm taking those lessons to try to make what we do better. I mean, the next time out of the gate, if it comes to that. And even in regular everyday, we learned some things that we can apply to just everyday stuff. I mean, we're not simply protecting vaccines moving around. We're protecting all medicines, opiates, all kinds of high risk, high value type commodities and things like that. We took an awful lot from what we've learned in the last 2 years, and we're going to not only apply it, but we're going to get better at it. That's the drive from my group for the next, for the next couple of years. I mean, getting better at what we do.
Yeah, I think my sort of final takeaway is I'll just keep it short to two, because I think Chad and Chuck both hit on some great points. Going back to what Chad said, gleaning on your peers for lessons learned, I think that's, a great thing. We're 2 years into the pandemic. We've gone through a lot. So moving forward, just taking those lessons learned, applying them to your plans, continuing to adapt, make those incremental changes and improvements. And then also going back to something we talked about earlier, with staffing shortages still remaining high, and burnout being a common theme among workers, ensuring you really take your breaks, because at the end of the day, we're at the front line, we're leading this charge. So it's important we continue leading that charge, but it's important that, you know, we depend upon our coworkers and we take our breaks and we keep moving forward.
Yeah, for us, I think we spun up a medical intelligence group within our team. We have some former operators and intel folks that do that for us. And one of the things we've done is we've worked with the government, with ODNI and CIA and FBI about what are the key intelligence questions we need to know about supply chain and manufacturing overseas for healthcare, right? You need to be engaged to it. I spent about almost 2 years teaching intelligence analysts and classes across the country at fusion centers. And the big thing I saw missing from all those fusion centers was a medical component, right? So don't be in healthcare and depend on non-medical people to get you the right medical intelligence. We actually proposed a 2-day medical intelligence training class for healthcare providers to work in those centers, and it just wasn't seen as needed. I think the second thing is don't assume your supply chain partner has a really good business continuity plan and that they know how to respond to an emergency. And I think the third thing is when you do exercises, you need to exercise your supply chain for things that is going to interrupt it. And how are they going to pivot and make sure that you get the supplies that you need. So exercises in healthcare are no longer bring in 30 patients and see how we handle them, right? It's how do I keep my plant running? How do I get my supplies here? What happens if there's international disruptions that could affect us downstream?
Really appreciate all those insights. I've taken a ton of notes. I feel like this discussion will be informing our after action report that's ongoing at Healthcare Ready. In the last few minutes, if there are audience questions, definitely want to take those. But in the meantime, or if not, want to thank Chad, Chuck, Scott, and Sean for joining. Really, really appreciate this discussion and your partnership. I think that was a theme of this discussion of kind of the importance of having partners to lean on that we know we can depend on. So I know we all, we at Healthcare Ready lean on you that way, so much appreciated. And looking at the question and answer in the chat, not seeing anything. If that's the case, if there aren't any questions, happy to turn it back to you, Laura, and the AHC team.
Well, thank you, Courtney. We did get one question come in, and I don't think everybody on the panel could answer, but maybe pick a panelist, Courtney, and ask, what's the one thing states could do to streamline COVID response? That might be hard to do in
I feel bad calling on someone. Scott, thank
Scott's
you.
Volunteering.
Yeah, just because of the multi-state presence we have, one of the things I've really been asking for is that it would help if states would be more cooperative with each other, right? So I think it's great that the federal government has a plan, and it's easy to work with the federal government because they're working in unison. But the difference between Kansas and Oklahoma, or Michigan and Wisconsin and Illinois, is vastly different. And what you do in your state that's different from another state, whether you realize it or not, it really affects you. And so if we could have more of a NIMS-like structure with states cooperating while maintaining their independence, I think that would be one of the most helpful things we could do.
Awesome. Thanks, Scott, for taking that one for the team.
Well, thank you to the whole entire panel. There have been so many compliments coming through chat and Q&A for this session. And we really thank you for providing all of your expertise. Courtney, Chad, Scott, Chuck and Sean.
Thank you.
It's my job now to introduce the break.